ಮೇಡಮ್ ಮ್ಯಾಮ್ ಕೇಳಿಸ್ತಾ ಇದೆ. ಹಲೋ ಮ್ಯಾಮ್ ಕೇಳಿಸ್ತಾ ಇದೆ.
ಹಾ
ಆಡಿಬಲ್
clear ಇದೆ.
ಐತಲ್ರಿ?
ಈಗ ಬಿಡೋದ್ ಬೇಡ, ನಾ ಹೇಳ್ತೀನಿ ಶಿವಾನಂದ್.
ಸೌಂಡ್ ಜಾಸ್ತಿ ಐತೆ ಇಷ್ಟೇನಾ?
ಕರೆಕ್ಟ್ ಅದ.
ಓಕೆ ಓಕೆ ಓಕೆ.
Ma'am, hope everything is fine.
ಹಲೋ ಡಾಕ್ಟರ್ ಹರ್ಷಿತ್.
Ma'am, this is Likit, ma'am.
Likit. So still students are joining. Can we wait for another 2 minutes?
Yeah, sure, ma'am. Gautam, you can start after 5 minutes.
ಮ್ಯೂಟ್ ಮಾಡಿ. ಇದು ಮ್ಯೂಟ್ ಮಾಡಬೇಕಲ್ಲ ಅಯ್ಯೋ.
Hello.
हाँ मैडम
Hello.
हाँ मैडम
Dr. Likit. Dr. Likit. Hello, Dr. Likit.
Yes, ma'am.
So can we start? It's already 6. 6 it
Yes,
is.
ma'am. Yes,
Oh,
ma'am.
okay.
shall I start or you'll start sir?
It's a few seconds.
Voice is not clear.
Hello.
Voice is not
Hello.
clear. Hello.
I'm audible, ma'am.
No, you can audible. Yeah.
Jai Shri Gurudev. Namaste to everyone. Myself Gautam. Let us
You are not audible. Dr. Gautam, you are not audible.
Oh, okay, ma'am. Wait 1 minute, ma'am.
ಮ್ಯಾಮ್ ನಂದು ಆಡಿಬಲ್ ಇದೆಯಲ್ಲ
ಶಿವಾನಂದ್ ನೋ ಪ್ರಾಬ್ಲಮ್. ಸ್ಕ್ರೀನ್ ಶೇರ್ ಮಾಡಬೇಡ ಈಗ ಸ್ವಲ್ಪ ಅವ್ರದ್ದು ಸ್ವಲ್ಪ
ಇಲ್ಲ
ಮುಗಿಲಿ.
ನಾ ಬರೀ ಓಪನಿಂಗ್ ಅಷ್ಟೇ ಕೊಟ್ಟಿದ್ದೆ ನಾನು
ಎಸ್ ಓಕೆ.
Jai Shri Gurudev. Namaste to everyone. Let us begin today's our program. Success in AIPGET is not determined by intelligence alone. It is built on the foundation of clear guidance, consistent preparation, and unwavering determination. Every successful postgraduate journey begins with a single step in the right direction. The AIAPGET oriented class, Homeopathy, is a dedicated initiative designed to help aspiring postgraduate students understand the examination, develop preparation strategy, this will provide valuable insights into very easy to implement planning, time management, preparation techniques, and the mindset required to excel. Led by experienced mentors and academicians, the orientation will equip participants with practical strategies, avoid common pitfalls, and stay motivated throughout their journey. Whether you are Whether you're just beginning your profession or looking to refine your approach, this orientation will serve as an ideal starting point to transform your aspirations into achievements. Join us as we take the first steps towards excellence in AIAPGET and embark on a journey of learning, perseverance, and success. Jignasa. Jignasa is a pan-India movement dedicated to creating an unveiled platform for addressing all dimensions of Ayush systems, Ayurveda, Yoga, Unani, Siddha, Sawa, Rigpa, and Homeopathy. Our motto? Our motto is Learn Ayush to Practice Ayush. Jignasa Karnataka stands as a pioneering organization among Ayush students in the state known for its innovative ideas and impactful programs. We have successfully organized landmarks events such as International Conference and National Arogya Fair in 2018, 2022, and Yantra 2023 and Matanam 2024 in collaboration with NIMHANS. For the homeopathic fraternity, Unnati 2024 was a unique platform dedicated to empowering homeopathy students. We have actively partnered with Government of Karnataka in Yoga Day celebrations, and our flagship event, Achintya Ayurveda, has emerged as a leading conference in the field of Ayurveda across the state. To promote traditional cow-based health practices, we have consistently conducted Panchagavya workshops, training students and practitioners in the preparations and benefits of cow-derived products. Reaching out to understand and rural areas has been a priority. We have conducted numerous health camps, awareness programs, and Swarna Bindu Prashana drives aimed at improving children's immunity. In addition to support Ayush students during their academic journey, Jignasa Karnataka has continuously organized online classes, exam preparatory sessions, and career postgraduate guidance programs, fostering the clarity and confidence among graduates aspiring for higher education and professional excellence in the Ayush domain. Dr. B.D. Chetty Homeopathic Medical College Hospital and Postgraduate Research Center, Dharwad, was established in 1992 to provide quality homeopathic education and healthcare located on a 5-acre campus in the heart of Dharwad. Just 1 kilometer from the central bus stand and railway station, the institution offers modern infrastructure, well-equipped laboratories, a rich library, and experienced faculty under the leadership of Principal Dr. Anand J. Hosso. The college is permitted by the Ministry of Ayush, Government of India, Government of Karnataka, MARBH, and the National Commission for Homeopathy, NCH, and is affiliated with Rajiv Gandhi University of Health Sciences, Bangalore. The institution has been awarded an A+ grade in the QCI NCH rankings for its excellence in homeopathic education and quality healthcare. Every successful journey begins with guidance of someone who has walked their path before us. Today, we are privileged whose knowledge, experience, and dedication have guided countless students toward academic excellence. It is an honor to welcome a speaker who is here to inspire, enlighten, and empower us on our AIPGT journey. With great respect and admiration, let us introduce our today's esteemed speakers. As we have two speakers today, it's my privilege to introduce them.
Yes. Shall we start? Madam? Are you
It's my
audible?
privilege to introduce our first esteemed speaker, Dr. Shivanand Naik sir. Dr. Shivanand Naik sir serves as an associate professor in the Department of Forensic Department and Toxicology at DPHPS Dr. B.D. Jetty Homeopathic Medical College. He brings 12 years of teaching experience and is widely appreciated for his expertise, academic commitment, and dedication to shaping future healthcare professionals. We are delighted to have him as part of his orientation program and eagerly await his valuable guidance. We welcome you, sir. Also, we have another speaker today, Dr. Vinay N. Kulkarni. Dr. Vinay N. Kulkarni is a professor in the Department of Community Medicine and at DBHP's Dr. B.D. Jetty Homeopathic Medical College, Hospital and PG Research Center, Dharwad, Karnataka. With an impressive 26 years of teaching experience, he has made significant contribution to medical education and public health. His dedication to teaching and mentoring has inspired countless students throughout his distinguished career. We are honored to have him with us today and look forward to gaining valuable insights from his session. I welcome both of you, sir.
Okay, thank you, sir. Thank you, sir. Okay, can we start?
Yes, sir, you can start.
Okay, thank you. Good evening to everyone. Today we will discuss the chapter of what you call the topic is the subject is forensic medicine and toxicology. So why to study forensic medicine in AIPGET? Because it is most commonly asked question, because it is very usual, that is factual and easy scoring, and they will ask you for 3 to 5 marks, where you can score your high marks in these 3 to 5 questions. And usually it is factual and scoring also. Important areas where you can go for in the topics in the FMT subject, that is consent, identification, injuries, death, and toxicological poisonings, and next followed by antidotes. So likewise in identification, whenever people will start with, there are different ways and methods of identification like age, sex, and followed by teeth identifications. So identification is a favorite topic in entrance examination. The most reliable routine method is fingerprinting, while the most accurate method overall is DNA profiling. So most accurate method is DNA profiling in identification. And DNA profiling was developed by Alex Jeffries. Questions commonly asked about its inventor or its application in pattern disputes and decomposition of the bodies. So the most reliable is fingerprint, and most accurate is DNA profiling in identification. So the next pair we'll go through with the chapters, that is age estimation, and it is one of the most commonly asked questions of age estimation in FMT, that is dentition and the ossificant centers of the bones. That is age estimation questions commonly involve dentition and ossification centers. The wisdom tooth eruption age of 70 to 25 years is repeatedly asked, and along with that, in the tooth where we are having a dental formula, that is 2123. The next high yield point in this is wisdom teeth, that is 17 to 25 years, where they will ask you most oftenly asked questions. The next comes is consent, one of the most commonly asked question, that is there are implied consent, express consent, informed consent, and proxy consent. In the consent chapter, consent is extremely important because it's combination of medicine and law. Informed consent means the patients understands the nature, benefits, risk, and alternatives of treatment. And the most oftenly asked question, which consent is mandatory before surgery? That is informed consent. The answer will be an informed consent. Then next in the chapter, where we'll go through with medical negligence, and one of the most commonest questions asked in the medical negligence. There are so many: professional negligence, medical negligence, corporate negligence. In this, they will ask you about their duty and their breach and the damage to the patient. So when it comes to remember the 3 essential elements, that is duty of a physician, and if there is any breach in the examination or evaluation of the patient, examination of the patient conditions in emergencies or in postmortem findings, those are all. And next comes is damage. What has happened to the damage? The medical legal importance of this medical legal importance. That is, without all 3 negligence cannot be established. That is duty, breach, and damage. Frequently asked question is res ipsa loquitur, means the thing speaks for itself. Means whatever they have done, the nature and the scenario of the cases, whatever they will be done in their duty, and if there is any breach occurs and the damage occurs, the thing speaks for itself only. This is about medical negligences and most commonly asked question. Then next we'll go for an injuries chapter, and one of the frequently asked out of 3 to 5 questions in this injuries is must and should. So most commonly, most of the people will not read the injuries. So better you go for the readings of abrasions, contusion, lacerations, incised wounds, and stab wounds. And most commonly, most injury questions involve differentiating abrasion, bruise, laceration, incised wound, and stab wound. And for the quick revision, sharp weapon does injuries like an incised wound, while as blunt weapon causes an lacerations. So one of the most commonly asked questions of injuries in this chapter, you must, if you go thoroughly, then it will be fine. The next comes is what in the chapter bruise color changes in the injuries, that is red, blue, brown, green, yellow, means it shows the duration of the color changes of the, or says the duration of the injury when it occurred. That is, abrasions are superficial injuries involving only to the epidermis. They are important because it can indicate the direction of the course. Examples, while as road traffic accidents commonly produce grazed abrasions, is one of the most commonly injuries in, or what you see, the bruise color changes. It means the changes of the skin texture and the color, the injuries and the duration can be seen through it. The next comes is firearm injuries, one of the most commonest are ballistics injuries. They will ask you, and next followed by what you call the heat, cold injuries, thermal injuries, one of the most commonest questions. And in this, they will ask you about commonly entry wounds and exit wounds of the bullet. Entry wounds, how it looks, and exit wounds, how it looks. Differentiate entry and exit wounds carefully of the bullet. And most commonly, entry wound will be showing small and inverted into the skull or any part of the body. It is small and it is inverted. While as an exit wound, it is large and everted. So this is about firearm injuries. The next comes is what? Burns. And most commonly burns, there are Wilson degrees of burns and rule of 9. That is, remember the rule of 9 because it is repeatedly asked a question. I think all of you know these things when people will start, when you read in second year, and it is also most important for treatment purpose, even in your clinics. That is 9, 9, 18, 18, 36, and 1. Means 9 parts for the head and neck, anterior and posterior, and then 18 parts for the arms, 18 parts for the abdomen, and the next legs, 9, 9, 9, 9, and 1 part for the perineum region. This is about rule of 9, most often asked question. Mechanical asphyxia, it is one of the most often asked questions in this: hanging, drowning, suffocation, and strangulation. They will ask you in this asphyxial parts, asphyxiants. That is, mechanical asphyxia includes hanging, strangulation, drowning, and suffocation. So the common memory is HDSS, that is hanging, drowning, suffocation, and strangulations in the answer for that mechanical asphyxia. The next question comes from hanging. In that hanging, the most commonly thing you will see is oblique ligature mark. That is V shape and O shape. O shape is for homicidal, that is killing from the other person. Suicidal is V shape. Most commonly you will see in the hanging, that is oblique ligature mark. Saliva, there will be a dribbling. The next strangulation you can see. The next horizontal ligature mark can see in homicidal. The next hyoid fracture is one of the more common fracture of hanging. So they will ask you, if they will ask you hyoid bone fracture in which it is commonly in hanging purpose. The next comes is what? Postmortem changes, one of the most important all over the part of your poisoning cases. Whenever you people reading any poisons, you must read the postmortem changes of the poisons. Like how best example is the postmortem changes of the body. First you will see is what in the body? Pallor. Second you will see algar mortis, that is nothing but an cooling of the body. The next livor mortis, where there is an the body suspends upon the floor, where there will be an bluish discoloration of the body. And the next, where it settles. And the next comes is rigor mortis. It is nothing but a spasm of the immediate, or rigor mortis and cadaveric spasm. Both are different. Rigor mortis usually occurs in the death, and while as cadaveric spasm, sudden death or a instantaneous death. So please do go through that. And the next, in this putrefaction chapter, you will get adipose, that is saponification, and the next followed by mummification, who is lean and thin. And adipose or a saponification is commonly seen in fat people, fat obese people, while as in putrefaction, most commonly everyone goes through with this putrefaction in the dead bodies. Then next, what you call excessive in organophosphorus poisoning, that is commonly seen is excessive secretions of common signs and symptoms of organophosphorus poisoning is salivation. That is nothing but a sludge, SLUDGE. That is salivation, lacrimation, urination, defecation, GIT disorders, and emesis. That is emetics. Sorry, there is a decation, that is defecation. And the next, the treatment aspects for this organophosphorus poisoning is most commonly they will go for atropine and tralidoxime. The next, in the chapters, in the heavy metal chapters, that is most commonly is arsenic. They will ask you arsenic poisoning. Then next, lead poisoning, that is Boltonian line, and what do you call anemic, lead anemics. Then next, mercury, that is commonly used in mirror factories. So you must read about these heavy metals poisoning and differentiation of the arsenic, lead, and mercury poisonings. Then next comes the chapters is in postmortem changes, carbon monoxide and hydrocyanuric acid poisoning. Commonly we'll see cherry red discoloration of the part, or what you call in the postmortem changes, we will see the tissues will be cherry red discoloration. It is due to oxygen and hydrogen sulfide, where it acts upon the cellular oxygenation that leads to what? Cherry red discoloration of the postmortem tissues. That means after postmortem, all the organs will be in a cherry red discoloration. The next commonly seen in one of the most commonly asked question, snake bite. There will be a differentiation of what you call viperine bite and colibrin bite. So most commonly in the snake bite, neurotoxic is what you call one of the most commonest in cobras, that is colibrin, and while as hemotoxic is commonly seen in viperas or viperidae group, and one of the most commonest poison is, rather than hemotoxic, it is neurotoxic in all 90% of snake bites in the world. So most commonly is snake bite is cobras, neurotoxic. The next in what you call in important antidotes, that is for heavy metals, that is naloxone, BAL, that is nothing but a British anti-levisite or dimercaprol. It is also called as a chelating agent, and even desferoxamine. These are all what you call some of the antidotes which they will oftenly use in their practice. The next, even atropine for organophosphorus poisoning. The next comes is what is the AIAPGET strategy? That is, first comes is what? Revision and more MCQs, PYQs, and mock test. If you apply, if you read it in correct manner, and if you do it in cross-check your MCQs and all, and when you give test, be damn sure about what you are ticking and what you are writing and reading. So if you have any doubts, you can ask now. Thank you, one and all. Any questions and discussions, please? Am I audible? Hello.
Yes, you are audible. Dr. Shivanand, you are audible.
Any questions? Hello.
Can you share some MCQs to the students?
Ma'am, these are all the MCQs, most commonly asked questions, so I have done like that.
There are options. The options are there, no? So some options if you give, so one student is asking.
Any MCQs? No, I will just share it once. No, ma'am, it is in computer. Some of the direct questions I have told.
Ma'am, we will move on with the next speaker, ma'am. Meanwhile, the sir can prepare us the questions, ma'am.
No, ma'am, I do have, but it is in other PC. I will just get it.
Then show, okay, sir.
Thank you.
Hello, Dr. Vinay sir. Dr. Vinay sir, can you hear me? Dr. Vinay Kulkarni sir.
Madam, yes,
Sir, yeah, okay.
ನಾನು ಶೇರ್ ಮಾಡ್ತಾ ಇದ್ದೀನಿ ಮೇಡಮ್.
Yes, okay.
ಶೇರ್ ಆಗಿದೆಲ್ಲ ಅಮ್ಮ?
ಇಲ್ಲ,
Hello.
chair ಆಗಿಲ್ಲ. It is no. That you have to remove. That you have to stop the first one. Already you are in screen share.
Yeah, I am already in screen share, right, ma'am?
That you have to stop it, and then again you have to share the different.
No, I can I tell, no?
Yeah. But that you have. Okay.
Set
You
one.
can ask.
Yes, my dear students, set one FMT MCQs. That is Lanovo hair first appears in fetus at what month? already we have given the answer. That is second month, third month, fourth month, and fifth month. That is most common answer is fourth month, the lanugo hair. Lanugo hair, anyone can tell how it looks? Am I audible?
Yes, sir.
Fourth month. Any questions? Sir, can you please tell something about autopsy and sexual jurisprudence? Okay. Ask autopsy, that is what you call in medical legal autopsy, most commonly we will see on the skin incisions, they will ask you, that is I shape, Y shape, and modified shape. Modified I shape. They will ask you in the questions, that is what is the skin incisions. So one of the autopsy, in that autopsy most commonly how we will do what you call postmortem. And in that postmortem, you may ask questions, then I can tell you more better rather than what you call. The next, sexual jurisprudence, rape, that will ask you, the people ask you the rape, that is section 375, which indicates about what it contributes or what it says in rape cases, and 376 section, they will tell you about the punishment for the rapes. And earlier days, they used to call IPC, then next what you call IEA, then next CRPC. Nowadays it's become BNS, Bharatiya Nyaya Samhita, then next BNYS. So there are something what you call new different sections has been done in the constitutions, and along with that, in this sexual jurisprudence, most commonly asked is section 375, and section 375 always tells about how the rape will occur and what it consists of. So will and consent is two important hierarchy in any rape cases. The next sexual jurisprudences, like along with that, where you can get in abortions, what do you call in abortions, criminal abortions, they will ask you most oftenly asked question. And then next one, some important some tips, some important questions for us. Okay. Next comes is the third one. Following may be seen in the executum, that is abrasion collar. In terminal illnesses, care to be provided, painless shortening of life is termed as palliative cure. Euthanasia is nothing but a mercy killing, which is not there in India. There are so many different set of questions which you can ask, like postmortem findings in carbon monoxide poisoning is cherry red hypostasis will be seen. Next, anyone? Anything? Yes. Any questions?
Some questions are there. You please see the chat box, doctor.
Yes, ma'am. Sir, can you please tell me something about autopsy? I have told, ma'am. And sexual jurisprudence, they ask most often asked question is rape.
Okay,
Also.
the dactylography you asked.
Pardon, ma'am?
Just next, you go to next question. The two other questions are there.
I'm just saying it's not coming. Yeah, the one question.
Dactylography, they're asking dactylography.
Dactylography is nothing but a fingerprinting. ಇಲ್ಲಿ ಕಾಣಿಸ್ತಾ ಇಲ್ಲ, ಬರ್ತಾ ಇಲ್ಲ ಇದರಲ್ಲಿ.
Just scroll down, you will get.
ಸ್ಟಾರ್ಟಿಂಗ್ ಹೋದೆ. Oh, ma'am, I'm not getting it. Eighteen 36 last ಬಂದಿದ್ದು. Private message. Private message.
Doctor, you can just scroll up, you will get the questions.
Ma'am, I'm just doing it, ma'am. About dactylography, discoloration due to cyanide poisoning. The marblings. Next question, about sexual intercourse. About dactylography. Yes, dactylography is nothing but what you call fingerprint, and in that fingerprint, most commonly we'll take out the four parts. That is, there are four different types of fingerprint. That is arch, loop, whorl, and composite. The next comes is what? Dactylography. Discoloration due to cyanide poisoning. That is nothing but a cherry red discoloration. The next, the marbling seen in dead body is hydrocyanuric acid. Due to sulf-hemoglobin, the present in the sign where it is going to attack upon the about lucid interval. Lucid interval is nothing but a person who is mentally ill earlier. He will be normal. He will take a treatment and he will become normal. In between the insanity will appear in between the normal mental health, and he become panic, and he will do some illegal, or it might be any harmful act, and where he may not know what the act he has done. So he is not they will not provide that fellow any punishments for that act, because he is under treatment also, and when he is normal, he will be they will be sent out from the hospital. And usually the lucid interval is commonly seen in very rare cases, but yes, it might be seen, and most people, they will do this lucid interval part. Like an example, in Kannada film also you can, Punit Rajkumar, Nata Sarvabhauma, mentally ill, they will tell. That is lucid interval. Next, anyone next, discoloration, dactylography. Any questions, please? McEwan sign. McEwan sign is nothing but in extreme alcohol poison. That is third, coma. That is more than 300 gram percentage or 400 gram percentage of alcohol when the person will have. That is in a coma stage, where the person will be slapped, and they will check whether the iris or the person is opening his eyes or the pupils are dilated or not, we will see. That is commonly seen in MAC1 sign. In alcohol poisoning, that is when they will take more than they want. It is in a coma stage, excited stage, incoordination, and CNS depression or the in the coma stage. See commonly in MAC1 sign. Sir, hanging, no more specific feature, ligature mark or dribbling saliva, sir. Ligature mark, one of the most commonest thing you will see because it is an externally easily appearance. Dribbling saliva can be when it is there earlier, after the more like more than 12 hours or 10 hours, it differs. But most commonly, ligature mark is a more specific feature. Any other questions, please? Different types of antidotes. Okay. First is in the treatment of poisoning, ABCD, airway, breath, circulation, and depression of the CNS. Ingested antidotes are different, and injected antidotes are different. And when the poisons will enter into the blood, the mode and method of treatment will be different. So in that gastric lavage will come. In ingested means within 2 to 3 hours before they will give gastric lavage. If they will have engulf or something or drink or something. If they have injected, then obviously they should go for treatment like chelating agents. If there is a heavy metals poisoning and all, that is BAL, penicillamine, EDTA, and like example, another antidote. The antidotes are nothing but an demulcents, where fatty food they are given. Demulcents, fatty foods, bananas, and another thing they'll go for dialysis, hemoperfusion dialysis. They'll go for. There are so many 17 to 18 different types of in treatment of poisoning you will get. Sir, active charcoal is given in which case? When the person is in engulf is better, means ingestion. When, sir, doctrine of res ipsa, the scenario of the crime or the scene of the the scenario of the crime occurred, it will say by itself. So that is nothing but a res ipsa locator. The position or the scene of the crime, they will tell in this manner. Res ipsa. It will speak itself only. What has done and what is not done. Medical negligence in poisoning cases. Yes. Most of the time, the patients will not tell the poison they have took. The symptoms. Medical negligence in poisoning cases most often occurs in our day-to-day life. And medical negligence here, not medical negligence, patient negligence will become more rather than medical negligence. The patient will not tell. But in medical negligence, yes, it occurs. That's what you know. Duties of doctors in the case of suspected poisoning. You do read first. Duties of doctor in case of suspected poisoning, which you had not read in your topic in second year. In case of poisoning cases. Next, anyone? Okay, then I think it's better to transfer to our next teacher. Okay. So, share. Sir, you
Hello, Dr. Vinay sir. Is there any problem?
No. Yes, madam, audible?
Yes, you are audible, sir.
Sir, many queries are there.
So let Dr. Vinay should continue, Dr. Shashi. Later, we'll see.
Okay, ma'am.
Any questions, sir? So, screenshot. I need to screenshot, madam. Wait.
Yeah, you share the screen. Your video is, you just,
Oh, it is off.
hello?
I'm on the video, ma'am. I'm on screen.
Yes. Now you can share the screen, sir.
Here. Yes. Is it visible? Screen.
Yes, sir.
It is visible, and you just click on the PPT presentation, sir.
Yes, ma'am. Yes. So, good evening, everyone. Welcome to this online platform about the community medicine and its applied aspect and importance in the health, as well as in case of the illness. So I had a picture in the previous. There is the pictures on one side it is the sunrise and the other side it is the sunset. Because the thing is the one is regarding the preventive aspect. Whenever we consider the community medicine, the preventive aspect becomes the most important, like that people think. But not only that, even the other work or other duty is regarding the managing or curing the sick people. Okay, so that is why what the thing is, the not only about the prevention, even about the curing of the illness. So that is going to be the kind where in case of the studying the about the community medicine. And one more thing is it is very vast, this community medicine. As you know, it is very vast. Day from the sunrise till that of the sunset. So whatever that the factors and whatever the activities and the individual does, so they are all going to be in case of the community medicine related aspect. Okay. So these are the things, they become most important. And coming to the next slide, the definition aspect. So in the definition, if we consider the, it's a branch of science which deals with the prevention of the illness, the awareness about the illness in the sense of promotion of the health, then maintenance of the health, and as well as to carry out the rehabilitation method in a group of the people or community. So these all the very big factors are there, and that the doctor or that physician who is related to the community medicine work or duty will carry out all these regarding the prevention of the illness. Suppose, see, earlier our ancestors, they were very much wise enough and very simple. They used to tell regarding the certain tips of health. Okay, like mainly not only regarding the getting up early in the morning, as it is very opposite nowadays. Okay, and one more thing is regarding the diet also, regarding the nutrition also. By avoiding certain kind of the excess oil or the kind of the certain food, so those things. And not only that, even the medicinal point of view, by use of turmeric, by use of the mustard oil, or the other aspect also, other kind of
the food ingredients which they were using, like clove or that of the aseptida. So these are kind of the things, they are part of preventing some of the illness which can be possible to recur, or they are going to be leading for persistence of the deterioration of the health. Okay, so that is going to be well avoided by these wise people. And even the kind of use of the curds. So the curds, mainly it is a probiotic and prebiotic. What nowadays the so-called the great physicians they advise. Earlier only these our ancestors they were knowing about that use, and much of the illness they were being under control by use of such curds. Okay, so those kind or buttermilk. So that is what it was helping. And coming to the other aspect in case of the preventive one, mainly regarding the whenever there was any indigestion, so during that time they used to add more the lemon and then some of the cardamom to the water and certain sugar to mix to take. So thereby the indigestion was being under control. So that was one kind of very excellent way of preventing the illness. That is another thing. Now coming to the next one, in case of the awareness about the illness or regarding the promotion of the health. So in case of the health promotion, so that also is of a very important one whenever in case of if we consider that of the certain chlorination method nowadays which is being used. Earlier the use of the neem leaves and even that of the nilgiris, so they were being of a very important one, and that is another kind of health promotion aspect. And similarly there are other kind of the health promotion aspect also, like whenever the people they were having the means they were roaming all the way and coming from long distance, so they used to be given the what jaggery mixed water, because it was giving energy. And one more thing, it was helping to prevent, or it was helping to maintain the health. So that is also another kind of the thing. And now next one is regarding the maintenance of the health. Again, it is the extended part of the promotion of the health, mainly the asking the patient or asking the people to lead a happy lifestyle. So that also is a very, very important one. A proper kind of lifestyle is going to maintain the health, especially before sunrise. They have to get up and carry out their work duties, and using the coal mixed this one, okay, in order to have the cleaning of the teeth. So that is also another kind of the thing. And then next one is regarding the rehabilitation method. So that rehabilitation method doesn't mean in case of some health center only. Even whenever there is a group or community people are there, the soothing words is going to help, and it is going to make them more motivated. Okay, the word of some motivation or some kind of assurances during the difficulty time, that is just enough. That is what it is going to motivate. And nowadays, regarding the rehabilitation, another aspect is there. So that another aspect is what these kind of certain disabled people. So when they are there, they are given the supporters, the like lot of the clippers. So that is one thing in case of the polio suffered individuals, or whenever the individuals are those kind of the people where they are disabled while working in a factory. So they are also being rehabilitated. And similarly, in case of the alcoholism people also, the rehabilitation method is being followed. So overall to say, in case of the community medicine, there is the ways how it goes by, like preventive, promotive, rehabilitative, and curative services in a group of the people. Am I audible? Hello?
Yes, sir, you are audible, but are you sharing the screen? The next slide is not visible, or still you are in that first slide?
No, I'm in the second slide, madam.
Still it is in the first slide only.
Oh, 1, 2, 3.
Can you please share it again so that we can?
Yeah, please. Now it's visible?
It is
Madam?
visible. It is visible, but the slide is not moving. It is not going to the next slide. Go back to the previous.
This is first slide. Now it is okay. I think it is visible.
Yes, it is visible. There is slide share. Okay, otherwise you continue in this.
Yes.
It is
Yes.
in the second. Yes, it is in the second slide.
Yes.
Yes, sir, you can continue.
Yes, madam. Thanks a lot. The community medicine relates with the certain ways or certain methods like preventive, then promotive, then rehabilitative, and curative services in a group of the people. So this is what in case of the community medicine, the objectives, what we say, or the way how it goes by. Because see, the principles or objectives, they are very important in as we inculcate in even in the life also. The similar kind in case of the community medicine, these become much important one, necessary one. So third slide. It's a kind of a field concerned study regarding the health and disease in a defined group or community. And its goal is to identify the health problems and needs of the people. So this is what again the same, nothing but the previous definition, but in certain other sentences are there. Okay, and other kind of its extended objectives are there. So that is what it is given here. It's a goal to identify the health problems and needs of the people, to plan, implement, and evaluate the effectiveness of the healthcare system. In case of community medicine definition aspect, which I wanted to mention. And here, this in case of the community medicine, the other coordination is required, like the sector intersectoral approach is there. The health sector, then educational sector, then agriculture sector, then food sector and industrial sector, and so many other sectors they are going to coordinate or hand in hand. And that is what it is very important when it is going to be in case of the intersectoral approach. Whenever there is the as we say in case of the homeopathy, the body, mind, and soul, when they are in a balance, so that time it is the health. That time the fellow is said to be apparently healthy or normal. But when there is the certain disturbance is there, imbalance is there, that time it is going to lead for sickness, or that person becomes abnormal. So that is why when this community medicine aspect, community medicine objective, when it needs to be properly managed and properly carried out, these intersectoral approach becomes utmost important. The health sector already it is the other kind of the health sectors they are going to contribute, and that is why the health sector is mentioned. And the educational sector, in case of the educational sector, the school, one thing, and second one is related to the certain kind of the places of the working where the education is given, or that awareness about their health is given. So that is what regarding the educational sectors, because that becomes most important in case of the school, mainly preschool children diseases, which we commonly observe, which we commonly come across, and that is one of the biggest problem. Most of the communicable diseases in case of the community medicine, they relate with that preschool children diseases. And earlier these kind of diseases were very severe one, and most the mortality rate was high among those kind of the preschool children diseases. Like it could be the earlier diphtheria was there, and mumps was very severe, measles, and smallpox, like that it was there. But nowadays the diphtheria is not seen, but regarding the mumps also the severity is there, measles also the severity, and likewise even the bronchopneumonia, so many other diarrheal cases, or that of the any other kind of the illness, the diseases may be related to the viral influenza. So those kind of the illness is more common among the preschool children diseases, and that is what it is one of the serious concern, and it needs to be very carefully assessed and prevented if possible, or it needs to be managed effectively. So that is why it becomes the most important thing. And even the nutritional aspect also, malnutrition can produce the effect over the studies, and even that of their growth also. So that is also another thing. Then agriculture sector, in case of the agriculture sector, when it influences over the community medicine, in the case of the certain the people where they are having the some sadness, or some kind of the fatigue in life, if they wander near the agriculture fields, or if they are made to stay in that agriculture fields, the environment is a very healthier one, and the ultimately the hormonal effect was found, and it was having a very good effect over the health. One thing. Second one, these kind of the certain ways. See, suppose the farmers, some people nowadays even they are barefooted while working, and thereby they develop the worm infestations. Or sometimes what happens is the kind of certain insecticide, when it is excessively sprayed in those agriculture fields, uh, but the fellow is daily having that exposure of that insecticide, can develop the problem. So this is also another kind of the thing in case of the agriculture sector. And not only that, the certain grains, or certain the food, which are which are out of this agriculture sector, so they are going to help and to grow and to have a very good kind of the health. And even the food sector also, the food sector, what I said just now, few things, even that of the other kind of the food, like it may be the milk, or it may be the some meat hygiene, or it may be something of a different kind of the food, like organic food. They are very nowadays talk of the town, because they are going to matter a lot in maintaining the health, and even the kind of spreading the good comfort among the group of the people or society. So that also is another thing. Then industrial sector, see, industrial sector is like a two-edged sword. The thing is, whenever in case of the industry, mainly the emanation or that of the poisonous gases which come out of that industry during the manufacture, they are having the detrimental effect over the health, and that is to be avoided. Or these industries, they should know how to make this kind of the stopping of these poisonous gases, or liberating if these kind of the poisonous gases, they need to be in a very certain level. And the other kind of the thing in case of the industry sector is regarding the occupation, regarding the growth of the nation. So
Vinay sir, sorry to interrupt you. Uh,
yes,
Vinay sir, can you hear me?
yes, I can hear. Yes.
You put a slide share, sir. There is one button, slide share. Down, right end.
Because that was a problem earlier, and that's why I did not use that slide share. Sorry. Okay, now it is visible
On which slide you are, sir?
on third slide. 1 minute.
Okay.
Second slide. Now it is yes. Now intersectoral approach.
Okay. Continue, sir. Continue.
Now, coming to the topics of the community medicine, today's community medicine topics like epidemiology is one, and then environment and health. Next one, the concept of prevention in which occurs or which is a part of the concept of health and concept of disease. So these topics and still more the other topics of the somewhat later to mention, like nutrition and health and mental health and then occupational health. So coming to the epidemiology, it is going to have a very lion share in case of community medicine, because most of the related topics which you come across in case of AIPGET or in case of the PG when you pass through this AIPGET, so they are all related with the epidemiology topic, and that is what mostly 60 to 70% of this regarding the epidemiology is going to be in case of the PG or in your AIPGET test. So when we consider this epidemiology aspect, mainly there are certain things, certain factors which are going to be related to this epidemiology. Like it could be that of the national immunization schedule, and then afterwards the national health programs, and then afterwards the other like it may be that of the analytical epidemiology or a descriptive epidemiology, or even the other kind of the things like related to the communicable diseases or non-communicable diseases altogether. That is going to be in case of the epidemiology aspect. So just I will then coming to the environment and the health. In case of the environment and health, as it is together called as the laws, like light, air, and water, soil, and sanitation is going to be the laws. That is what the total environment and health aspect. And this environment, when it is affected, when it is contaminated, it is going to create the more of the epidemic illness, or it is going to lead for usually the infectious kind of the illness. So that is why this environment and health topic also is taken, it is also selected, and that is very important because when we visit in your PG, when you visit the health camps, and when we visit the certain villages, when the health camp is conducted in those villages, so this environment and health aspect becomes the most important thing to look for, because the resources, mainly that of the water and air, in case of rural areas, especially that of the water. So that water is very contaminated, unfit for drinking. But even then, the villagers, they are unaware of it. Rural areas people, they ignore regarding the cleanliness of the water or maintaining the sanitation of that water, and thereby they develop the more kind of these communicable illness or that acute infectious diseases they are going to be due to such use of the contaminated water. And then afterwards, regarding the air, when we consider that of the air, so there it may be relating to many of the things, like that of the certain use of the chemicals which is spoiling the air, or certain kind of the compacted places or unscientific construction. So thereby that is also again creating the nuisance, creating the problem. and thereby the air has become very affected. So that also is another thing. And similarly, when we consider that of the soil, so that soil, when it is contaminated or affected, it is going to create the problems in the form of mainly that the developing the sludge. So that is one thing. Or it can be one of the factor for the worm infestations, or it can be leading for certain other kind of the health related problems which these rural people, they often suffer with. Okay. So skin lesions may also be another part of the problem, and that is also another thing. Or sometimes the fluorosis or the presence of the excessive lead in the soil can also be leading for the health problems. So that also can be another thing to observe for. And then there is the light, because of the inadequate light, so many health related problems can happen. And glare is one of the very, as you know, in case of the late night, or in case of when it is very much dark, so that time riding the vehicle or traveling becomes very problematic. Why? Because of the glare, the contrast, what it is in the background, that is not matching with the vision. So that the viewing becomes very disturbing. So that is why it is going to create the health problems. It is going to create the certain kind of the illness, and thereby that also is very important to consider. And that of the diffusion of the light or entrance of the light, usually, because I have to relate, I have to tell these things some elaborative, as they are one of the very important topics. Okay. So the kind of the windows or the doors which are at a certain direction, usually if they are at the east facing, so then it is going to have the adequate kind of the light and adequate air exchange, and thereby again if you consider that of the philosophical way, vastu, so that is what the even it is having the scientific background, and that is going to help, and that is going to limit much of the problems, much of the complaints. In case of the people, the possibility that they may suffer with the certain airborne sickness or certain infectious diseases, or their immunity becoming affected when there is the inadequate kind of the air or light is there. So that is also going to be the problem in case of such things, such people. Okay. Then coming to the next one is regarding the concept of prevention. In case of the concept of prevention, as the community medicine, the major is regarding the prevention, and later things are regarding the management of the sickness or illness. But in case of the concept of prevention, when we consider, there are certain levels of preventions are there: primordial prevention, then primary prevention, then secondary prevention, and tertiary kind of the prevention. Suppose in case of the people where there is the possibility of the goiter is there, and they are advised to take more salt which is mixed with the iodine. So that is the kind of the primary prevention, because it is leading for health promotion aspect. Okay. And if it is the primordial kind of the prevention, mainly the people who are far away from that place, but when there is some possibility that they may get affected with the illness, and that can be prevented. How? Especially when it happens when there is the severe outbreak of illness at a certain place, and that it has not reached the next place, but priorly coming that, so the people, they are going to have their kind of the preventive aspect. So that is also another kind of the thing, like chlorination of the water, adequate chlorination of the water, or they are cleaning their surroundings, and then afterwards so many other kind of the disinfective measures they are following. Then coming to the next one, in case of the primary prevention, the vaccination is also a kind of the primary prevention, which is going to be of a very like a specific protection. So that is one of the vaccination, and in case of the vaccination, see BCG is Bacillus calmette-guerin, which is for used as a preventive for the tuberculosis, especially during the soon after birth it is given. And this BCG not only helps to prevent tuberculosis, it was found that the leprosy was also under control by use of BCG. So that is what one thing the use, and even in case of the polio also, it to a certain extent this polio was also being under control by use of BCG, and that is one of the very important kind of vaccine which has been given, which has been administered since so many decades, and that is one of the thing. And oral polio, see, the thing is nowadays we are having the booster dose. That is what a very common kind of the advice the health sector people they give. Why this oral means a booster dose? Because in order to prevent the complications. As such, the polio cases are absolutely in zero, okay, or they are hardly seen nowadays. But even then, booster dose is being advised. And earlier, this polio was a very dangerous kind of the illness, and which was leading for not only the mortality cases, even the disability. So it was leading for disabledness, and that is what overcome by the use of the oral polio vaccine. And next, second level of prevention. In case of the second level of prevention, as soon as the certain symptoms they tend to appear, the kind of diagnosing and treating. So this is what it is going to be in case of the secondary prevention. Treatment is mainly the simple kind. Okay, so that is what is the thing, and that is usually going to be related with the certain use of some antipyretic, so or some kind of the anti-inflammatory, that kind of the dose, or that kind of the medicine is given. But usually what happens is the disease has not become fully blown, okay, or it has not become fully developed. Just a few symptoms, very mild form it is appearing, and the patient will be in a panic. So that is why for giving the psychological advantage, even we can indicate this placebo also during that time. And coming to the tertiary kind of the prevention, that becomes very problematic. It is when the very severe cases, or where the very advanced stage of the illness happened, and almost it is leading for either death or the disability. So during that time, this kind of the tertiary prevention is carried out, and this is what is going to be related with the rehabilitation or disability limitation. And disability limitation in case of leprosy, which we find nowadays a special kind of the footwear for the leprosy people, and that is what is going to help to avoid the injuries, and to not to make them suffer further. Okay, only the kind of ulceration, nodules, and the paralysis. So that is what it is there. And next, in case of the rehabilitation, if you consider the cancerous individuals, cancerous people, so during their they need a kind of some soothing words, and some kind of the self suggestions. So thereby, that is again helping in the form of the rehabilitation. Recreation is another thing in case of this people when we want to help, or when we want to consider about these cancerous people. So there they need this kind of the methods. The rehabilitation is another one, and this rehabilitation, even it is given, or if it is even followed in case of certain other illness, certain other kind of the diseases, where in case of the people who have got injured while working in a factory, and they will be in a severe depression, and that time the rehabilitation is very important to lead for. And so many other kind of the diseases, the illness which the patient is not able to overcome repeated IBS problem can also produce the effect over the mind, and thereby it is having the good help by the rehabilitation. Rehabilitation can help nowadays. So many therapies are there, and that is what it is helping to limit the problem, to limit the complaint. Now coming to the concept of health and concept of disease. Excuse me, I will go to next slide. In case of the concept of health, it is. So the dimensions of the health, mainly it is what which we find in case of the concept of the health, as the physical dimension, then mental dimension, that is what emotional and intellectual together, that is what the mental dimension, and social dimensions, and then vocational dimension, spiritual dimension. So this is all comprised in case of the dimensions of the health. An individual has got these 6 dimensions of the health, and if there is any problem, any imbalance, significant imbalance, then that is going to lead for this illness or those things. It is just like the two-wheel cart. Okay, if both the wheels are in a balance, if they are in a very proper place, and they are even, so that time it is not a problem. If some wheel it is going to be imbalanced, so entire that the cart will fall. So similar kind in case of the dimension of the health, that is if the person is affected emotionally, that is also going to lead for the illness. If physically there is the imbalance, and that is going to again reflect over the mind, and entire that dimension of the health becomes difficult. Social that the bonding will be not there, withdrawing from the society. So all those things that is going to happen. And vocational, that also is another kind of the thing in case of the dimensions of health. If that is not there, means the fellow who has just lost the job, or who is in danger of losing the job. So that time this vocational, that is what it is going to matter, and that is going to lead for the problems in case of the dimensions of the health. So now coming to the next slide, the concept of well-being again, which is there in the concept of health. So here the 3 levels they are going to matter a lot: standard of life, then levels of life, and quality of the life. So here the quality of life becomes the very core of that entire the kind of their making the proper socio-economic status, and then afterwards having that the qualities in the form of morality, and in the form of certain facing the problems. So all those things that is going to be in case of the quality of the life. And in case of the levels of the life, so there it is having the external circle, mainly just in the form of which are most essential for the life. So that is being considered, like the security, and then afterwards the basic needs, and then afterwards that of the carrying out the work. So all those things. And in case of the standard of the life, so that is again related with the socio-economic status at the surface. So what it is, the outer aspect, how the appearance, and how they have to spend their time in the life, and they objectives is not clear, and the spirituality is not there, and the morality to some extent is not developed. Means they follow that principles, but even then that is not a satisfactory one. So this is what in case of the concept of the well-being, which is a combination of both the subjective as well as objective components. Okay, and then coming to the next one, regarding the national health programs, in case of regarding the certain communicable diseases, we are having the certain days, World Health Days, and thereby we observe those in the form of conducting the health camps, and conducting the rallies, or having the certain the skates or role play, or any of the giving the guest lectures. So those things, that is what it is usually followed. So why this is there? Why it is important? This kind of the national health programs. What is the objective? What is the purpose of doing such kind of the things? Earlier, regarding the health, apart from a few kind of the illness, it was not that much given full attention. Okay, especially when there was the outbreak of the plague was there, and that of the tuberculosis was there, or that of the other kind of the infectious diseases. So that time, only to that limit, and whenever there was outbreak, so during that time, they used to give the medical aid and then healthcare services. So that's what it was enough. But now it is not like that, because most of these communicable diseases, they are going to be because of the national vector-borne disease, or you can say it as the vector-borne disease. Okay, and 70% of these communicable diseases, what we find, what we have in case of nowadays, they are because of the vectors, and that's what. If you consider the malarial complaints, and to control the malaria, in 1953 only, the first kind of controlling the malaria, or they went for eradicating the malaria only by use of DDT. But what happened was, the DDT for meanwhile, or for time being, it was effective. But because of some lack of the follow-up, or administration problems, or not having the adequate staff, so that is why these kind of malarial complaints, they started to research. There was a research, or there appeared the re-emergence of these malaria cases, and mosquitoes, they were resistant to DDT now. So that is why what they changed the objective from the National Malaria Eradicating Program to National Malaria Controlling Program. And usually this malarial, these kind of the preventive, or that of the health program, which is in the month of April 25th. April 25th. So during that time, this regarding the prevention of the malaria, World Malaria Prevention Day is observed on April 25th. And that of the next, coming to the other kind of the communicable diseases, National Tuberculosis Elimination Program. As you know, there were nowadays, it is having a very great kind of the preventive aspect, not only just regarding the kind of using the medicine, or that of the giving the health care service either at a clinic or some hospital centers. Even the technology, the use of the technology, and then afterwards the diagnosis in an effective manner by the latest devices. So that is what it is helping. And one more thing is added to that is regarding the identification of that patient, and that patient is identified by the bystanders, and that bystanders will be benefited by giving the certain amount, 1,000 rupees. So that is what. So this is what, in case of the National Tuberculosis Elimination Program, has become advanced. And usually this the tuberculosis preventive day, or National Tuberculosis Preventive Day, it is observed on March 24th. Okay, March 24th is being the most important kind of the health day, where it relates with the tuberculosis control program. Okay, so that is another kind of the thing which is there. Then the other kind of the factors, if you consider that of the National AIDS Control Program. So this National AIDS Control Program, it will be observed, or usually it will be in the month of December 1st. This National AIDS Control Program, that is going to be observed. First case, in case of India, 1982, in the case of HIV was reported, and since then the government became alarmed about this, as it is very dangerous for the public, So that is why the National AIDS Control Program, that schedule is planned on December 1st. Similarly, the World Hepatitis Prevention Day, of course, it is celebrated in a different manner, means it is observed in a different manner. Based on that, scientists who observed or isolated the virus of the these hepatitis, and Bloomberg isolated them. It was in the year July 20, sorry, in the month of July 28, on this Bloomberg birthday. So on remembrance of his birthday, so that is why this World Hepatitis Prevention Day is being observed. And the another kind of the, of course, the universal immunization program, that is what in case of when it is the Pediatric Association, and as well as from the WHO, the what their objective is being followed. So this is having the more emphasis or more kind of its influence over the developing countries. The main intention for this immunization or this kind of the preventive aspect was mainly they found out the certain vulnerable kind of the places where the health was a very big question, like Africa and Southeast Asian regions. This Southeast Asian region, as we say it as the SEAR, SEAR. So there, this the microorganisms, their capitals was there. Okay, usually the infection or acute kind of the illness, epidemic or endemic, any kind. So they were very much seen, or they were very much prominent in those kind of the places, especially the or continents, mainly the that of the African continent and Southeast Asian regions. And this is what the WHO observed there, and they started to make a project, and they started to have the kind of the immunization in those countries. Okay, and also one more thing was they started to develop the traits in these developing countries or poorly developed countries, and that is also another kind of the objective was there. And because of their vaccination, mainly certain illness, which I said, by use of BCG, the tuberculosis or leprosy, much they are under control, and that of the oral polio vaccine, that is also going to, of course, at most it has eradicated the polio. So this is what the things are there in case of the universal immunization program, the national health program aspect. It is one of the national health program aspect. Coming to the non-communicable kind of the health programs which are being present, which are being there. Okay. So suppose if you consider that of the cancerous condition in case of the non-communicable the health programs aspect, the February 4th, the World Cancer Prevention Day is being observed, and then afterwards the kind of problems usually which are going to be high or which are going to be means mainly seen. Okay, so that is what in case of the cancerous condition in the Western countries, this cancer usually it is going to be like in the stomach cancer or that of the breast cancer. So this is what predominant in case of the Western countries. But in case of the Indian or in case of the Asian continent, mainly that of the oral cancer, the tongue cancer, and the cancer of the esophagus is being observed more. Then coming to that of the diabetes, World Diabetes Prevention Day. So this is being observed in the month of November, and November 14th is being observed as the one of the health program for the diabetes. And again, the thing is diabetes. It is no. The India is known to be the capital of the diabetes, and it is having the second largest number of the diabetes cases. So it needs to be prevented, or it needs to be somewhat kept under control, and that is what the government is doing through the certain conduction of the health programs. Then Coming to that of the World Hypertensive Prevention Day. In case of the World Hypertensive Prevention Day, mainly it is relating to the May 17th is one of the World Hypertensive Prevention Day. And again, as I said, these non-communicable diseases, silent killer, and then afterwards, nowadays we find these hypertensive individuals are being more. And these are kind of the things. So that's why the health program is being conducted. It is there in case of the non-communicable kind of the diseases based on the remembrance of that people or scientists one thing, or that kind of immigration, or that the season where it is going to be more in case of the where to limit that spread, or to make the people aware about those complaints. So that is why it is being given. Okay. So these all the things are there in case of the national health programs. I will proceed to next slide. So this is about again the national immunization schedule, that schedule I have in this slide regarding the kind of in the BCG at birth and OPV at birth. So that is on the 6th week and 10th week and 14th week also. Then even DPT, that is also the 6th week and 10th week and 14th week is there. And hepatitis B at birth, that is again can be given the booster and the 6th week and 10th week and 14th week. Usually the DPT is trivalent, and hepatitis B comes in the form of pentavalent, like it is conjugation of the DPT, then hepatitis B and Hib conjugate. So this is what is there. And measles MMR was there earlier, but nowadays only the measles vaccine is being given. And this is what in case of the 9th month it is usually given, this vaccine. And then afterwards the typhoid 2nd year and the 5th year and 8th year and the 12th year. So first it is given at the 2nd year, mainly the first dose, and then the booster dose is going to be given. And coming to the next one regarding the TT or TD, at the 10th year and 16th year is the period where the this vaccine is given. So now coming to the next slide. This is what I was referring to, the vector-borne diseases, and that is again the topic which is related with epidemiology. Some of the illness like malaria, dengue, chikungunya, or filariasis, Japanese encephalitis, all those things, that is what it is going to be because of the vectors, usually the insects, what commonly said as. And this transmission of these kind of the vectors or arthropod-borne diseases, they are having the direct contact. Through the direct contact, they are going to have like bite, so those things. Then mechanical transmission, while carrying the object, they can contaminate, and they are going to either food or water. So thereby that kind of the vector-borne disease can develop. And biological kind of the transmission is mainly in case of that the development cycle. Okay. So that is either it may have one host or it may have more than one host. So that is going to be in case of these vectors, and this vector-borne diseases is there. And this is what another thing which is present in case of the transmission of the vector-borne diseases, that is there. Okay. Then coming to the next one, how to prevent these overall I have told you about the vector-borne disease, but regarding the health programs, and if you consider that here about the prevention of the dengue. So prevention of the dengue mainly, as you know, the eliminating the standing water is one thing, and mainly the stagnant water. So thereby that is going to mainly help in stopping the breeding of the mosquitoes, or it is having their kind of suffocation. And then next one is use of the mosquito repellents. So this is also another thing, but it can limit. It is not entirely killing those mosquito, or the mosquitoes, they are going to again lead for the complaints. Then coming to the next one is regarding the certain kind of the PPE kit. Okay. or that of the using mainly the the type of wearing the protective clothing, the full sleeve and protective clothing, thick clothing. So this is what so this is going to be of a very important one. So thereby mosquito bite can be avoided. And one more thing, the better one aspect, because usually what happens, the Anopheles mosquito, it is going to be more active in the evening time, whereas that of the Aedes aegypti mosquito is more in the daytime, and that of the Culex mosquito evening to the early morning hours. So there, this Culex mosquito is more active, and that is why when there is no any necessity to go outside or to wander, better to stay indoors. So that is very important. But Anopheles mosquito has got one very strange kind of nature, that it doesn't make noise. It will come very silently and bite. So that is why in case of the Anopheles mosquito, whereas that of the Culex mosquito and the Aedes aegypti mosquito, they make the noise so while having this meal, blood meal, what is said as. So this is another thing which is going to be present. The other vectors which are going to be responsible for not only the kind of these illness, the hepatitis may be there, or amoebiasis may be there, or cholera, or it may be rickettsial diseases, or that of the Kashmir forest disease, any kind of these diseases. So they are going to have the preventive aspect accordingly. Okay, suppose if it is that of the amoebiasis or that related with the houseflies, so that time it is better that kind of the manure or that kind of the dumped garbage. So it needs to be disposed in an effective manner. One thing. Second one is the hand hygiene process, that becomes most important, and then afterwards use of the insecticides is also very, very important one. Then coming to the kind of rickettsial diseases during that time, the personal protection is becoming a very important one, and then maintenance of the hygiene, and then not being in a overcrowded region, overcrowded area is also very, very important factor for developing these kind of vector-borne diseases. So that is why when the individual, or when these kind of the people suffering with the vector-borne diseases like rickettsial disease, they need to be away. They need to be at a far place. So that is going to be means they should not be overcrowded to say. They should be in a well-ventilated and well-aerated room, and or well-aerated place, and clean one. It should be clean one, and their hands also should be clean. So the hand hygiene process also very, very important in controlling most of the communicable diseases, and that is why the emphasis or that kind of importance is given regarding the hand hygiene process in case of epidemiology aspect by use of the disinfectants, as it happened in the COVID time, mainly in case of the use of the sanitizer or use of certain kind of the disinfectants. So that is which was very, very effective, very important kind in preventing the illness, further kind of the communicable diseases. Now coming to the next one, when you consider about the non-communicable diseases, so this is what diabetes mellitus nearly it's a home for the diabetes, and then 75 million are diabetic, and higher prevalence among the males. Every year, 5.3% of diabetics are diagnosed. So this is what one thing. Then coming to the next one, how to prevent, again as the health program and observation is there, and then afterwards the regular monitoring of the blood sugar and care of the food, improving the lifestyle, and avoiding the salty and spicy and the sweetened foods. So that is whenever necessary. So that time it is going to be of a very important one. Usually that of the salty and sweetened foods, they are going to be of a very important one to avoid. Okay, so this is another kind of the thing. And then coming to the hypertension, in case of this hypertension, it has nearly the 9 circles. Okay, 9 circles are there. out of which the general population, the overall population, and these kind of whole community is not knowing regarding the hypertension. And then afterwards, the next circle is regarding the normotensive subjects. Okay, and these kind of the people, even though they are having the problems, but they are not exhibiting the symptoms. They seem to be normal kind. And then coming to the inner circle, that is the hypertensive subjects, and this is where these people, they experience the symptoms, but when they experience the symptoms also, they neglect or they are not properly diagnosed. And in case of the further inner circle, there is the undiagnosed kind of the hypertension. Even they come for the regular health checkup, but they are not diagnosed, and that is what or they are keeping the disease to themselves, and this is also going to be problematic. And coming to the further the other group of the people, the inner circle, so there the diagnosed kind of the hypertension is there, and the people, they are being treated, and but in the next circle, that is diagnosed but untreated. And further, in case of the next one, that of the diagnosed and treated, and last few circles, in that the patient is inadequately treated, and that disease remains, this kind of the hypertensive state remains, and thereby that is going to be like the iceberg phenomenon. So this iceberg phenomenon is what mainly the usually what happens is, in case of the community or in case of the physician, so he is able to see the apparently sick individuals. Okay, can easily assess or can easily diagnose regarding the individuals who are sick, but they can't easily diagnose, or from the distance it is very difficult to mention that the individual, that fellow is sick. So this is what in case of the submerged kind portion of the iceberg. So tip of the iceberg, they are relating to the infectious diseases, whereas these kind of the non-communicable diseases, they come under the submerged portion of the iceberg. And this kind of the state is very difficult for the physician unless they diagnose at the first. If the disease becomes progressed, and it is going to create the complications, it is going to lead for the difficulties in case of their health, and so many other added problems. Okay, so this is what in case of the relating to the hypertension and the rule of horse. Then coming to the primary health center, in case of regarding the concept of health, how this can be means healthcare services, how they are going to lead for, and how they are going to help. So totally there are the kind of affordable services. The primary health center is a kind of the essential healthcare services to the very needy people. It started with the intention where the remote people or tribal people who were not getting this health care. So that is why for them this kind of the healthcare services was brought, and that's how the primary healthcare it became existed because of the Boers Committee 1946. Okay, from there only this Boers Committee it started regarding this the starting of the primary health center, and in 1977 onwards this primary health center and their importance, and even the resolution was passed in the 5th year plan. Okay, 5th 5-year plan. So thereby it was having a very good kind of the effect, and the people they were given proper healthcare services. The affordable services was there, and then the quintable services was there, and then afterwards approachable services were given, and then afterwards there were other kind of the things like appealing if they were having some kind of the problems. So they used to have the they will be visiting this healthcare, and thereby getting the help, and then afterwards seeking their services, and it was helping them. So this is all the in case of the primary health center, and this nearby Dharwad, there are I think means in our vicinity area. So nearly one is at the university, so that the public health center or primary health center is there. One, and second one, in case of agriculture college, the another primary health center is situated, and then Nigdi in case of the rural primary health center. So likewise, regarding the different, I think 4 to 5 primary health centers are there nearby this vicinity of our area, our college area. So this is what it actually the objectives. If we consider that of the primary health center, their objectives, it includes education about the prevailing health problems and controlling them or preventing them. Then promotion of the food and the proper nutrition, educating and giving the awareness about the proper nutrition and how it needs to be given or supplemented in a proper dose. So all those things, and what is the effect of it, the importance. So those things, that is what it is being mentioned. Then maternal child health care, this is what in case of the under 5 clinic, again it is there. That is also going to be the monitored in case of the primary health center. And usually this primary health center, they are having the full-time services like 24 hours availability, or it may be available for 8 hours. So this is what. And then immunization program, they carry out the immunization program, and this immunization program mainly the kind of health workers and health inspectors, either they may be attached to the field or they may be at the station. So like at that healthcare unit. So this is what is the carrying out the immunization program. And the ASHA workers and Anganwadi workers, they also contribute, and they also associate with the doctors in case of carrying out the immunization program. And see, the thing is, one more I wanted to mention, I forgot. There's the kind of Indradhanush scheme. So this Indradhanush scheme, why it appeared? What is the reason? That is having the immunization or prevention of the 7 kind of illness. Okay, and those preschool children diseases, the 7 kind illness, and they are going to be mainly prevented by the immunization. And when at the first time or in the early days of the prevention or giving the immunization, so during that time it was very people were not serious about taking the immunization, and some people, they were not there at that place, they were migrating to a different place, and that's how this vaccination or immunization was being missed, and they were not getting it regular. And in order to stop that and to overcome such kind of the problem, because there was a recurrence of the infections, or there were some kind of the complications used to arise, and in order to overcome such problems, mainly the Indradhanush scheme came into existence, and it's having a very great effect. So this is another kind of the thing. Then appropriate treatment for the common diseases and injuries, and provision of the drugs, all those things in case of the primary health center is being given proper services, and people are getting the advantage of it. And this is what very, very important in case of the objectives of the primary health care. Now coming to the which I was just regarding the classification of the waterborne diseases, because already I told you regarding the environment and health, how it is influencing over the people or over the community, and that is what. Okay, so in case of the waterborne diseases, mainly these is going to be very important, like organic one and inorganic kind of the substances which produce the waterborne specific, or you can say it as the the waterborne kind of the diseases. And then next category of the disease is water-based disease. Water-based disease is mainly relating to that of the plantations or hyacinth, what we say, and this is very unhygienic and unsafe for the people, and thereby it produces the health problems. Then water washed diseases, mainly in the form of using the utensils and cleaning the utensils in the water. That is one thing. And then afterwards, that of the certain worm infestations. So there we are having this water washed diseases. Then vectors or arthropod diseases, to some extent, they are also kind of the waterborne diseases. So these are certain things which are there in case of classification of the waterborne diseases. Now I will go to the next one. How the purification. So how this purification is there, or that filtration method is there in case of the regarding the waterborne diseases. To avoid the waterborne diseases, mainly the rapid sand filtration is there, and slow sand filtration in large scale. What I am telling. If in case of the small scale, that is different. It relates with the household or small scale kind of the preparation or purification. So that is aeration, mixing, flocculation, filtration, then post chlorination. These all things are there in case of rapid sand filtration methods. Then coming to the vital statistics in case of the so in case of the vital statistics, the crude birth rate, the number of live births divided by ADR population into 1000. July is the month where this kind of the crude birth rate is calculated, and accordingly that is one of the vital statistics which is present, which is very, very important time. So now, am I audible?
Yes, sir.
Just I will share some of the MCQs. Hello. Is it visible screen?
Visible.
Yes. So first one, leprosy commonly spread by these options are there: milk, droplet, water, and mosquito. Usually it is droplet. So that is the answer for this leprosy, and the first one. Then next is, in case of the disinfection of the water, is an example of the recurrent infection, terminal disinfection, concurrent disinfection, or sterilization. So that is usually the recurrent kind of the disinfection. Then next is, in case of the natural history of the disease, which is established by the descriptive epidemiology, cohort studies, case control studies, and ecological studies. That is, option is, answer is A. Then coming to the next one, which of the following is most universally accepted and sensitive indicator of the whole population socio-economic condition under which they live? So here the options are disability rate, infant mortality rate, under 5 proportionate mortality rate, and life expectancy rate. The answer is B. Then coming to the fifth one, in case of the chronic hepatitis B, the serological marker which correlates with the level of the liver injury and the risk of the disease progression is usually that of the D, HBsAg. HBsAg in case of chronic hepatitis. The answer is HBsAg. Then sixth one, all of the following features are suggestive of the asbestosis except A can lead to pleural mesothelioma. Then disease progresses even after the removal of the contact or occurs within 5 years of exposure. Then sputum contains the asbestosis bodies. So here the option, the answer is C. Okay, that is occurs within 5 years of exposure in case of asbestosis. Okay, it is not true. Then coming to the next one, among the following statements, the false one which is there in leptospirosis, it is a zoonosis, then spreads by the contaminated water, man is the accidental host, and lice acts as a reservoir of infection. That is, the D is the answer for it. Like lice acts as a reservoir of infection, it is wrong. It is not true. Then coming to the next one, eighth one, which of the following is considered as a reference protein? So here the options are fish, milk, meat, and egg. Usually the B, milk, is the answer for this eighth one. Then last one, in case of the minimum airspace for each worker as per the Indian Factory Act is 200 cubic feet or 300 cubic feet, 500 cubic feet, and 700 cubic feet. So there it is, the answer is B. Answer is B, and that is 300 cubic feet. Okay. So these are some of the MCQs which I prepared in case of regarding this today's orientation class. Okay. So is there anything? Shall I repeat the answers for the MCQs? First one is B. First one is B, and that means a droplet infection. Okay. Second one is A, that of the recurrent disinfection. Okay. Then third one is A. Okay. And fourth one is B. Then fifth one is D. Sixth one is C. Seventh one is D. Eighth one is C. Then ninth one is B. 10th one is D. 11th is C. 12th is A. Then 13th is C. 14th is C. Then 15th is C. And last is the 16th is D. Till 9 I have told. And then afterwards regarding the, it ends regarding the today's community medicine orientation. Is there any doubt?
Dr. Likit, I think no one is having doubts.
Yes, ma'am.
ಶಕ್ತಿಯೊಂದಿಗೆ ಒಂದು ವರ್ಷದಲ್ಲಿ ನೀರಿನಂಥ ಕಠಿಣ ವಾಸನೆಯನ್ನು ಕೂಡ ಹೋಗಲಾಡಿಸುತ್ತದೆ. ಕರಿಯ ವಾಸನೆ ಹೋಗಿದೆ.
Ma'am, shall I propose vote of the tanks?
Yeah, please.
ಈಗ ನಮ್ಮ ಕರ್ನಾಟಕದ ಹೆಮ್ಮೆಯನ್ನ ತಮ್ಮ ಸಂಗೀತದ ಮೂಲಕ
Good evening, everyone. It gives me an immense pleasure to propose the vote of thanks. I thank both the speakers for making this PGT topics very easy and very comfortable for the students, and also we acknowledge for their efforts in making this session a wonderful, and also for giving us the mock questions. Thank you, sir.
Thank you.
I thank Jignasa team for the that without any technical glitches the streaming has done. Thank you so much.